what advice would you give anyone that is interested in pursuing aesthetic surgery?
And I see it this way as like people who do great work, but that just want to do a little bit better, right? That's what makes you extraordinary, right? People who are more conscientious about outcomes. I think if that's who you are, then you should absolutely do it. Even in residency, I really looked at or focused on how patients would look after. Not only how they would function, but also how they would look. And I think we miss that a lot in training. A lot of residency training, especially when you're in a big trauma hospital, it's about like function and putting like bones back together and so forth, but not really the aesthetics.
And why do you think that is? Because it was certainly like that in my residency. Why is it that we don't pay too much attention to the human wants and needs behind the patient we're treating? You know, because at the end of the day, everybody wants to fit in somehow and wants to feel self-confident about themselves.
Part of that has to do with like when you're in the beginnings of your surgical training, which everyone is in residency, you learn how to put things back together. I think that is...
You think it's just too much to handle or deal with?
I think it's another level. Yeah, it's another layer. So I think that's why you should pursue a fellowship training if you are looking for more advanced techniques and learning. And believe me, I had excellent training and also was, you know, in a unique situation with plastics and OMFS, but I think I'm learning so much more about how to preserve, how to aesthetically drive outcomes and outlooks. And so I think that is something that I was never really taught. I never really learned that until I came here.